Welcome to Get Moving TV. I'm Dr. Chris Landon. I serve as your host. I think what we've seen the most in the news lately, and we're going to continue to see, is the whole idea of healthcare reform. Healthcare reform, of course, hits me at the office. We didn't get IOUs from the state of California, but came awfully close. And all this puts my patients into a realm of terror because they depend on so many services that are paid for by programs like Medi-Cal. We have a county-operated healthcare system that will be coming, and that'll be opening up to public debate as well. We're going to need to have panels of people telling us what kinds of services should be covered and have the most priority. Hospitals are going to need to decide whether they're going to contract with this new agency. We have a program called ACE that has case managers for patients with chronic illnesses, patients who may have gone years without treatment of their hypertension or their asthma, chronic healthcare conditions that really are quite costly. With me today is Renee Nutley. She was on our show several years ago, and the healthcare reform and healthcare debate are part of her everyday life. She served as a case manager for her two sons. So Renee, what do you do during the day?
I teach school. I teach first grade at Mountain Vista School in Fillmore. And when I get home, I manage a team of nurses that help take care of the boys. And I shouldn't call them boys because they're 25 and 23 years old now. And that takes up every minute.
I think since I get voluminous emails from all the people who provide services for you, and have you had people go to bat for you in terms of getting services? You have to read the regulations very carefully, as I think all of us are learning.
We've been remarkably blessed by a team of people that have helped us get what we need on an ongoing basis. Dr. Paul Russell from California Children's Services actually met with a politician in order to help us get in-home nursing care so that the boys would not be in a facility. That was absolutely miraculous and has really made things much, much easier, both financially and emotionally, and all the way around for everyone. And another way we've been extremely blessed is we have a team of doctors that Dr. Landon's our pulmonologist, and he's in charge of all their respiratory care. And he is like the guru of hooking people up with equipment companies and so forth. And so we're hooked up with some really great companies that have actually been able to survive some of the California crisis this year by reconsolidating their business plan and things like that. But there have been times when we've been pretty nervous about it. In addition, we've been, it's been like a trio of things that have really helped us make all of this work. Peter and Robert have both private insurance and Medicaid. Without both of those programs working together, I don't think we would have survived. When there's a wall put up in one level of service, another level kicks in. And both insurance and Medicaid have had appeal processes that we've had to walk through with doctors, and doctors have had to write letters. Dr. Landon's has to write letters and treatment plans for Medicaid all the time to keep the services going. We also have a primary care doctor, Dr. Dawson of Conejo Oaks Medical, and he has to write letters all the time for Robert's medication because Robert takes Celebrex and for his spine. So everybody working together has been given the boys a quality of life that has been outstanding and has been the biggest blessing to me. I would do it all over again in a second.
Well, I think before we came on stage, you gave me some of the benefits of their quality of life. Some tomatoes that the boys have been growing and guiding their avatar. I guess they have a gardener, and
yeah, they hired a kid down the street to do some gardening for them. So they spend a couple hours a week telling him what they want done. They have a huge collection of succulents. They're very into succulents, and they kind of started collecting succulents when they were like 5. They would see their neurologist in Santa Barbara, and on the way back they'd stop at a garden place and buy a succulent. And they've done that their whole life, so they have all these succulents. So if anybody needs any cuttings, you should call me up.
So when you and I have spoken over the last 6 months or so, I know there's been some fear in your heart about healthcare reform, and you were approached by an organization back in Washington, D.C. What was the name of that organization?
There's an organization called Healthcare for Gunner. It's with a pro-life organization that is trying to protect the ability to get private insurance for patients like Gunner. And Gunner has cystic fibrosis, and he's a cute little kid. If you go on their website, he's adorable. And that family and a lot of other families are very, very concerned about continued access to health care. I would really like every family that has a disabled child be able to have the access to care that we've had and the support that we've had. Because every human life is so valuable, it cannot be given an economic number in any way, shape, or form. And there's a lot of fear among myself and other parents that have children with disabilities about rationing of care, because we know that the care that we're getting is very expensive. But most of us that are really involved have been able to kind of go through different doors to get what we need from different services and put together things. It hasn't been easy, and there's been multiple times when I haven't been able to, I thought I was gonna lose insurance, like the boy's dad would lose his job, and so there would be an insurance change. So I would purchase Cobra. One time I went to school and took classes, one class at a time, so that I could have their insurance policy. So a lot of people that are very concerned about their kids have worked really hard to try to keep insurance and choices. And mainly because a kid like this, not every doctor is prepared to handle. And there has to be a way to have a doctor that you trust and that wants to do the kinds of procedures that that you may think are necessary. And with technology being so advanced, not everyone has the cutting edge technology. We've been very fortunate that Dr. Landon was here in California, and we didn't have to go across the states to find someone that had a non-invasive ventilation approach.
So if you were to name off the 4 or 5 things that really children with special healthcare needs, like your boys, they're on the non-invasive ventilation at night. And Peter does he use a little SIP ventilation during the day?
Only when he's sick. Mm-hmm. They're feeling so good now that they're mainly needing it at night. And one of my real concerns, Dr. Landon, is that 2 or 3 years ago, I didn't think that they would make it. So if I had not had access to this level of care, I would not have known that the last 3 years would have been so great. But the last 3 years have been probably the best years of their life. And I think part of that is because their care is stabilized. There's no big, awful looming transitions. And everyone's really kind of at peace with the situation and comfortable with who they are and what technology they have. And it's...
So can you just name off some of the, so we need a good coordinating doctor. You're basically their case manager in terms of, and social worker in terms of getting all these services. We need a private insurance base. We need a secondary kind of insurance that can cover the things that are above and beyond that chronically ill children sometimes require.
And choice of all of those so that you can kind of build your team.
And then durable medical equipment. I know we went through some different suppliers until, who's their DME equipment supplier now?
We get our ventilator equipment, which is our main durable equipment at this time, from Unicare. And they're really great. Like I said, they kind of consolidated and they're doing mainly ventilator care and not other things. and we're getting wheelchairs and so forth from Tri-County Mobility.